As a board-certified OB/GYN and Black female physician, there is a stark difference in the treatment of women of color in pregnancy to that of white women. What we have seen nationally through pregnancy and also in the postpartum phase is that there's a staggering difference in statistics that lead to increase in maternal mortality, admission to the ICU for babies, and also in the postpartum phase, care that women get, whether that's with mental health care and also the care that's needed as far as postpartum complications that can come with postpartum hemorrhage, postpartum hypertension, and gestational diabetes. When looking for care as a newly pregnant woman or planning for pregnancy even, it is very important to ensure that the relationship you have with your OB/GYN is one that advocates for you as a patient and allows you to voice your concerns, opinions, your questions during the pregnancy phase. It is also important to make sure that you are getting the access to care and resources that are going to be needed during pregnancy. If there are any pre-pregnancy conditions such as diabetes or hypertension, or any concerns that have preceded this pregnancy with previous pregnancies, it is important that you also get the care with a high-risk doctor and making sure that throughout the pregnancy you are getting the best care for yourself as well as for your baby. Other things that are important is the hospital that you choose to deliver in. Ensuring that you get the care, whether that's with an OB/GYN that you have a great relationship with, that they have the credentials to deliver at the hospital that you would like to deliver at, and also having supportive care and staff during the delivery process, such as a midwife or a doula, which may assist with your delivery. Making sure that all of these are taken care of throughout the pregnancy and into the labor portion of your pregnancy are very important and key factors that you should look for early in your pregnancy. When thinking of medical care and the advances that we have seen over the last years and even decades, it is quite clear that we have made some strides in improving access to women's health care and also the innovation in healthcare that we see that's devoted to women's health. Women's health has notoriously been disregarded or put to the back burner when we think of innovation, technology, studies that would include women. So what we are seeing is that there is an increase in the actual women's health care field, whether that's with innovations, medications that are devoted to specific women's health issues, and also improving the access that we have to women of color in studies and also making sure that they get the access to care that we need. We have a long ways to go when we think of what we need in women's health, but we are making strides. The other important factor is that we are seeing an increase in the amount of women in medicine. We are seeing more women in medicine than we've ever seen before, and this is going to improve the relationship between studies, between patients and physicians, and also outcomes when we think of women's health care. In May of 2021, Governor Greg Abbott signed legislation that would ban abortion as early as 6 weeks. And in September of 2021, this legislation was not blocked by the Supreme Court, therefore allowing this law and this bill to take place. What we have seen is that this is going to significantly impact the 7 million women that are in the state of Texas of reproductive age. Now, since Roe versus Wade in the 70s, this was the ability for women to have the choice and the option when it comes to pregnancy and abortion and giving them the right that they deserve when it comes to their body. Now, with this setback, what we'll see is that this is going to significantly impact the access to resources and care that women deserve when it comes to the decision that they choose to make when it comes to their bodies. What we will see is that this will significantly impact women in making the decision, be it a short time frame from pregnancy to realizing pregnancy at 6 weeks in order for them to make a decision for themselves. This presents many logistical, legal, and financial barriers for women who do have to make this decision in that time frame, which is now at 6 weeks. How we can get involved as a community when we see these types of barriers in the legal system is to continue to voice our opinions and our support in order to overturn these narratives that we have seen in the last few decades. Now, it is ever so important to make sure that we sign petitions, that we vote for the people who are going to be in support of decisions that we need to make long term. This means that when it comes to voting season, whether that is a 2-year term or a 4-year term, but for both local and for federal and state positions, we have to make that commitment to ensure that who is representing us, whether it's for reproductive choices, whether that is for legal choices for us as a community, specifically for a community of Black and brown people, that we make that impact by voting together. Because of the barriers that we have seen with women being able to access the care that they need and to make decisions for themselves, I have taken the stance as a platform, as a OBGYN, as a woman of color, as a mother, and also in the positions that I have, such as Chief Medical Officer for Verywell Health, to provide people with the resources that they can use when they have obstacles or struggles with making decisions for themselves, considering their health. Now, making a healthcare decision is between a woman and her physician, and in the instance in this case where this decision may be an obstacle in making that choice after 6 weeks with this bill, is to provide women with the access and resources that they can get this termination or an abortion in another state with another provider. It is very important that we find ways for women to get the care that they need and not limit their choices and their abilities to make their best healthcare decision that is for them. As a physician, a woman of color, with a woman who has taken the opportunity to provide resources for patients who have difficult decisions to make but should still have access to those resources. This ban limits many women and patients in order to make decisions that are best for their health. Now, in Roe versus Wade in 1973, when it was considered unconstitutional to deny the access for a woman to get an abortion, this is what we're trying to provide the access for and to sustain this type of decision making when it comes to women. Now, if that means providing resources for women to go to other states and other providers who are going to give them the care that they need, this is what we can focus on as a community, as physicians, and taking the stance to support and provide resources for women who want to make that decision for themselves between the decision that they have for themselves with their healthcare provider.